The Salvation Army Catherine Booth Hospital is a short-term rehabilitation center founded on the Christian principle of loving care administered in a quality way. Although the Salvation Army has been operating a health care program in Montreal for about 100 years, this present focus on rehabilitation was commenced at the hospital in 1973. On any given day, you will be cared for by about 250 medical, professional and support staff, along with many dedicated volunteers. Hello, I'm Frank Reynolds. Being admitted to a rehabilitation center can be a very stressful event. You have recently experienced a physical crisis, which has also been very emotionally traumatic for you. Perhaps you feel very sad and frightened. This is normal because you have experienced a loss of some of your physical capabilities, which serves to threaten your future lifestyle. It is at a time like this you need to remember that you are not alone. You will meet other patients here who are traveling similar uncertain roads. Each patient has his or her own physical problem. It might be coping with an amputation, accepting limited mobility because of paralysis, or adjusting and recuperating after another type of medical intervention. I will introduce you to most activities you are likely to encounter while you are here. You will live here, eat here, and sleep here for the next few weeks. After all, you are now part of the family. You might have arrived on a stretcher or in a wheelchair. Different admissions procedures are used for different patients. No matter how you were admitted, we now have data regarding your medical status, as well as information that will allow us to send your bill to Quebec Medicare and to any other insurance plan you may have. You would also be wise not to keep a large amount of money at your bedside. You were also assigned a room, a patient number, and given a see-through bracelet to wear. A hospital medical record was opened for you, and the clinical staff were told of your arrival. Sounds like a hotel? Not really, but you are welcome. While in hospital, some of your time will be spent in and around your room. Make yourself comfortable, arrange your belongings, and do some exploring. You will be assigned a wheelchair if you need one to get around. It might please you to know that street clothes are encouraged here. A nice change from those fancy open-backed nightgowns. You will have your own private phone, which is billed to you at a nominal daily rate. Calls from outside the hospital will come directly to you by way of our switchboard. If you are looking forward to watching some TV while here as a patient, it will be quite permissible for you to have a small portable TV brought in from your home. Or you can go down to the patient recreation areas located on each floor and watch our hospital television there. These were donated by our own auxiliary. Speaking of volunteers, what a wonderful group they are. Our auxiliary, as well as our other hospital volunteers who work in coordination with our recreology department, infiltrate almost every department of the hospital with hard work and lots of love. All their services will make you feel more at home. There is a coffee shop right across from the elevators on the ground floor. Ben's might be famous for smoked meat, but our Evangeline coffee is famous, the best in Montreal. The boutique Evangeline is located right across the hall from the coffee shop. Here you can purchase greeting cards, practical items for your own use, and that little gift for your sister-in-law's birthday. In all kinds of weather, you'll be able to manage a shopping spree like this, one which can even include coffee with a friend. If you like to read, you will find a small library on each floor in the recreation areas that is restocked regularly by the auxiliary. While in hospital, mealtime may be one of the more important events of your day. Our dietitians are responsible for helping you plan your meals around any special dietary requirements you might have. Just fill out the menus that are distributed to you, and they will be picked up and delivered to our clinical dietary staff. You will like the fact that your food always comes to you fresh and at the right temperature because of the special attractive thermal trays. Better make sure you're at your bedside at approximately 8:15, 12:30 and 5:15 each day. Meals here are too good to be missed. One of the most important parts of your rehabilitation will be the visits from family and friends. We have no age restrictions for visitors, although certain hours are in effect. Visitors are welcome to accompany you to most activities except treatments and certain patient groups. Visitors are always welcome in the coffee shop and at designated times in the cafeteria as posted.
Happy birthday to you. Thank you.
Under the guidance of our Director of Professional Services, our team of doctors, composed of general practitioners and specialists, will monitor your medical condition. You will be assigned one of our staff attending physicians as your primary doctor. This medical person will draw upon any further medical information needed for your progress from our consulting specialists. Certain medications or tests might be needed to aid in diagnosis and progress. Our pharmacy will fill any prescriptions your doctor orders for you. The pharmacist will also teach you about your medications, answering any questions you may have. In the laboratory, samples of blood and urine can be analyzed by skilled technologists using the latest equipment. This information is helpful to ascertain your care plan. Rehabilitation is the main purpose you are here. An interdisciplinary team monitors and promotes that purpose. They coordinate information regarding your condition by sharing verbally and through documentation their professional opinions and findings. Your rehabilitative treatment may take many forms, including some of the following disciplines: physiotherapy, occupational therapy, social work, and psychology. Our therapists are the experts in improving functional performance, muscle strength, and emotional coping abilities. Let's visit some of these departments. In physiotherapy, you will have to work hard, but your therapist will allay your fears and might become one of your best friends. Your program might be exercises to improve your joints and/or muscles. You could be shown how to walk with different aids, or you may receive heat or ice to decrease the pain. We shall aim for you to reach the maximum of your capabilities by the time you leave. In our occupational therapy department, you will use interesting activities to increase your functional capabilities. You may also be given a splint to help recovery of an injured part of your body, and possibly devices to increase your independence in the home. Our social worker and psychologist are in the business of helping you accept yourself with the present reality of your situation, understand your emotional and social strengths and weaknesses, and cope with everyday life as it is for you. They are never without a supply of Kleenex in their offices, because often the ability to cope and surprising new strength is born through grief and tears. Such patient self-help meetings as the amputee and stroke groups may also be very supportive for you. Talking about self-help, you might be chosen to be a self-care patient while in our hospital. Although many of the disciplines contribute, it is your self-care nurse who will coordinate all this for you, giving you more confidence in yourself and making your discharge from hospital much more meaningful.
What about snacks?
Snacks don't count.
Being part of a family is not all hard work. Families have fun together too. Anyone who cannot enjoy a laugh once in a while is going to be lonely here. in the midst of what could be a time of doom and gloom for many of our patients, are times of fun-filled activities, such as trying out your culinary skills at a muffin-making class, or perhaps a sing-along with a guest musical artist, or even being the guest of honor at your own birthday party. Maybe a game of trivia where your answer is so wrong that even you think it's funny. All this fun and much more can be yours when you get involved in the activities of the recreology department. In the midst of all the hard work and times of enjoyment here at the Catherine Booth Hospital, you might just want to spend some quiet time meditating or talking with someone who is sympathetic and understanding. This is where our chaplaincy services come in. The chapel, which is located on the main floor, is available anytime for quiet meditation. Regular chapel services for both Protestants and Catholics are held weekly. Our own chaplain is available for counsel at any time. This department can also put you in touch with clergy of any denomination for a visit to you during your stay, should you so desire.
Terrific. That is terrific.
Saying goodbye is never easy, but the time will come for your discharge. This happens after the interdisciplinary team has agreed that you are capable of leaving. Although this does not mean that you discontinue certain aspects of your treatment, it does mean that you do not need to be hospitalized any longer. You will also be linked up to any community health or social services you might need. You might have mixed feelings about leaving. You might be fearful, but don't forget the confidence you've gained through the self-care program. You'll be just fine. But that's in the future for you. For now, just settle into your new home. There are also things you can do to help. Try to be completely open and frank with the staff. Don't hold back information that could help in your treatment. Try and cooperate, and if you don't understand what is happening, ask. The more informed you are, the more your treatment will be successful. Oh, one last thing. Before you leave, you will be given an evaluation form to fill out. Please complete it and return it to us. This is our way of finding out what you really think of us. We want our service to you to be the very best. After all, you are one of the family.